Good evening, everyone. My name is Dr. Bhanu Mishra. I'm an associate consultant with BLK Max Hospital, Delhi. And today we will cover the topic of urinary tract infection, which is extremely common and very underdog topic because a lot of people don't intend to speak on it. So before we go ahead on UTI, we have to know who are the people who gets UTI the most commonly. And the top 2 and 3 that comes to my mind are the people who have diabetics. Second, in females, especially in postmenopausal age group, and in males who has prostatic issues. These are the top 3. Apart from that, there can be many patients like stone diseases can have recurrent UTIs. People who have obstructive uropathy in form of urinary tract obstruction, if they can develop UTI. So these are the common risk factors which because of which you will get UTI. Now you have to understand urinary tract infection is primarily divided into 3 parts. One is the common one, which is called as the cystitis. This is the infection of your bladder which stores your urine. So this is the cystitis. This commonly is not very life threatening and usually is treated by oral medications itself. The next that comes out is the pyelonephritis. Now this is a serious infection in which your kidneys directly get affected, and the bacilli or the bacteria also disseminates into the blood and causes wide stream sepsis. Now this can be life threatening, and this needs an urgent attention, medical attention, and in form of antibiotics, admissions, IV fluids, and the need to assess the cause of why the patient has developed pyelonephritis. So these are the 2 basic ways of UTI. Now in general, people who had a history of UTI or who has a history of stones or their weight is on the extra side, so what they can do to prevent UTI. Now the fun thing that you should ideally do, first step would be to drink enough water so that your urinary tract stream and other things are clear of all the debris and no residual debris there in the bladder. So drink enough water so that you pass around to more than 2.5 liter of 2 liters of urine per day. That has a role in preventing UTI. Second is, if you are diabetes control is extremely important. If your HbA1cs are 7 and below, then you have better chances of not getting UTI. Third is, if you have stones in your kidney or urinary tract system, you have to get rid of the stones. Now, if they are big stones and small stones, there are multiple, but you have to see whether they are obstructing your urinary path, whether they are not obstructing. You have to immediately tackle the ones who are obstructing your urinary path, and you can do workup and take some treatment for the stones which are not obstructing the urinary tract system. So tackling the stones is extremely important. Now the third thing is, any obstruction apart from stone that might be there in your urinary tract system. It could be in the ureter or it could be in the urethra, which is a tract just after the bladder before passing urine. So a common test that we normally do at OPD level is a test called uroflowmetry, and in history we get a hint about that the patient is having weak stream, especially in males, or if a female is getting recurrent UTI, elderly age group, they can have meatal stenosis. So these are the problems which will get picked up by the uroflowmetry easily at our OPD level, and we can treat them. So these are the basic things in urinary tract infection. Now if you have diabetes, if you have risk factors which you cannot control, or you are having recurrent UTI, then there is a role of something called as suppressive antibiotics. Now when you are sick, you will take injectable or oral antibiotics of full strength for almost 10 to 14 days, sometimes 21 days is needed. But after that, if you have recurrent UTI, we can put you on a lower dose of antibiotics which will be there for another 6 weeks to 8 weeks and sometimes even 12 weeks. So this is called suppressive antibiotics, and it will prevent the infection from coming back. This is one important clinical nugget which sometimes our general practitioners tend to forget. So I would like to highlight that. And urinary tract infection ideally sometimes is taken very lightly. So we need to understand a lot of people suffer from urinary tract infection which will end up in urosepsis and sometimes end up in needing dialysis, which could be very derogatory in long term. So we should treat urinary tract infection in its full sense. Try to find out the reason why the urinary tract infection has happened and treat accordingly. I hope this lecture was important and has helped you in covering your UTI problems. Thank you.